This is our presentation for Cnur 400 Unit 2 on Canadian healthcare. This presentation is by Ashley, Ashra, Elise, Jolene, Kate, and Madeline. Premier Justin Trudeau announced at a recent UN conference on refugees that 31,000 Syrians have now been welcomed to Canada. According to the Immigration Minister John McCallum, Canada aims to take up to 57,000 refugees this year, double the number from 2015.
Refugee healthcare and government position. So these are just a couple questions that you guys should keep in mind throughout our presentation. The first one is, what are the changes in position on refugee healthcare from the last government to the new government's position? And do these changes coincide with Canadian values and the underpinnings of the Canada Health Act? Why or why not?
So this is just a little bit of background now. So what is a refugee? A refugee are people who are forced to flee their home country because of a well-founded fear of persecution and who are therefore unable to return home. Many refugees come from war-torn countries and have seen or experienced unthinkable horrors. A refugee is different from an immigrant, in that an immigrant is a person who chooses to settle permanently in another country. A convention refugee is a person with a well-founded fear of persecution based on race, religion, nationality, political opinion, or membership in a particular social group. Because of these conditions in their home country, their fear of persecution, they are unwilling or unable to return. What is the issue? So the issue is the refugee healthcare is an issue in Canada due to the influx of refugees from Syria. The war in Syria has gone on for 5 years and has claimed the lives of more than 250,000 people. The trouble began in 2011 when protesters took to the streets following the arrest and torture of 15 school children who wrote anti-government graffiti on a wall. Protesters then wanted the release of the 15 kids, democracy, and greater freedom for their country. The army opened up on the protesters and ended up killing 4 of them. People demanded that the president, Bashar al-Assad, resign. However, the president refused to step down. A civil war began between the government forces and the rebel group. In early 2014, the neighboring country of Iraq held an extremist group, the Islamic State, who began to take over large areas of Syria. The Islamic State is a militant group that uses violence against anyone who doesn't agree with their extremist views. There is still a standstill between the two sides, the government forces and the rebel groups, as Syria battles the militant group. This is why there are so many refugees who are currently fleeing to Canada.
So Harper's stance. In 2012, Stephen Harper introduced changes to the healthcare for refugees in Canada. The YouTube video we were required to watch for this class on the status of refugee healthcare in Canada during Harper's run in Parliament revealed some shocking statistics. Come 2012, there were 500,000 people who, because of their immigration status, were denied access to healthcare in Canada. Prior to this, the interim federal health program provided basic healthcare to refugees in Canada, which was similar to Canadians on social assistance. With cuts made, the government said it would save Canada $100 million over 5 years and would help filter out and avoid claimants that were abusing the system. The changes did not save money, however. Instead, refugees were avoiding spending roughly $60 for a doctor visit and instead ending up in emergency rooms, which is a much more expensive way to provide care. Wait times for health insurance eligibility in Ontario, Quebec, and British Columbia for new immigrants was 3 months. In 2014, a few changes were made in the interim federal health program because they violated the Canadian Charter of Rights. However, changes were not significant enough to really change the lives of refugees in Canada. For example, most privately sponsored refugees, refugee claimants, and refused claimants still had no coverage of prescription medication except for public health, public safety conditions, unless they were pregnant women or children under 19. Unfortunately, not enough changes were made to have a lasting impact on refugee healthcare, and there was still unfair rates for them.
During Harper's election, Doug Cnur, a Canadian doctor for refugee care, was interviewed to talk about the cuts regarding refugee healthcare. He stated that out of 45 clinics in Ottawa, only 2 clinics would actually see a refugee with a valid interim federal health card, despite the fact that they had a card just like a Canadian citizen going to the doctor with a health card. They would present the FH card and then be asked to pay an upfront fee, which is completely against universal health care. Many refugees were children who could not access their medication for asthma, diabetes, and other conditions.
So, Trudeau's stance. With federal election in late 2015, Liberal leader Justin Trudeau became the new Canadian Prime Minister. With his new leadership came new promises to refugees in and entering Canada. Come April 1st, 2017, all refugee health care will fully return to the way it was prior to the 2012 changes made by Harper. Also, prior to their arrival to Canada, refugees will have required medical exams, vaccinations, treatment of disease outbreaks in camps, and medical support during their travel here. In an article by CBC News, it states, refugees who need prescription drugs, vision care, and urgent dental care will now have coverage similar to what provinces and territories provide to Canadians on social assistance.
Justin Trudeau stated he considered airlifting Syrian refugees in order to fulfill his pledge to welcome 25,000 refugees by January 1st. Trudeau defended his promise to welcome 25,000 refugees by the year ends. The old immigration minister, Chris Alexander, from 2013, said that while security screening will remain the government's priority, his government will issue thousands of visas by the end of the year to people fleeing the civil war in Syria.
Next, we will talk about the Canadian Health Act, which covers comprehensiveness, universality, portability, accessibility, and public administration. Comprehensiveness. The healthcare insurance plan of each province territory must insure all insured health services provided by hospitals, medical practitioners, or dentists. Universality. The healthcare insurance plan of a province entitles 100% of the population within the province to the insured health services. Portability. A resident that moves to a different province or territory is still entitled to coverage from their home province during a minimum waiting period. This also applies to residents which leave the country. Accessibility. All insured persons have reasonable access to healthcare facilities. In addition, all physicians, hospitals, etc. must be provided reasonable compensation for the services they provide. Public administration. All administration of provincial health insurance must be carried out by a public authority on a non-profit basis. They also must be accountable to the province or territory, and their records and accounts are subject to audits. Do these changes coincide with the Canadian Health Act? Justin Trudeau has promised to restore complete health care for refugees living in Canada and for the ones entering Canada. This change coincides with one of the most important pillars of the Canadian Health Act, which is universality. This means that refugees living in Canada cannot be denied prescription drugs, immediate dental care, and vision care based on their living status. Additionally, these basic health services are accessible to refugees regardless of where they live and which physician or care facility they decide to choose. Healthcare services became portable for Syrian refugees before their departure to Canada when they were to have all the required medical exams, vaccinations, and treatment of disease or an outbreak done. Overall, changes that were made by the Prime Minister Trudeau to the Canadian health system do correlate with the fundamentals of the Canadian Health Act. How do these changes not coincide with the Canadian Health Act? Public administration. Even though Trudeau has decided to restore the healthcare plan for refugees, it is still going to take time to implement and make healthcare services available to all the refugees. It becomes a challenge for refugees to have any type of health insurance when they do not even have access to the fundamental health services. Comprehensiveness. When basic health facilities are going to be limited to Canadian refugees, services such as nursing services, public health services, communicable disease control, home care, pharma care, chronic care, and residential care are also going to be limited to refugees.
After looking at these rulings and opinions of both the Conservation and Liberal parties, or both governments, we can compare them to some basic values that most Canadians hold true for themselves and their country. The Canadian Index of Well-Being defined values as guideposts for how Canada can move forward as a society. Those core values include fairness, diversity, equity, inclusion, health, safety, economic security, democracy, and sustainability. Providing proper healthcare to refugees greatly coincides with the values of Canada, such as health, safety, and inclusion. Yet, as with every system, there are those who try to abuse the help being given. So with fairness in mind for the Canadian taxpayers and to the refugees, these services should only be provided to those who truly need help. So this just concludes our presentation, and thanks for listening.